first transfer we're going to work on today is the supine sit transfer. The most important thing to remember with any transfers is you want the patient to do as much work as they possibly can. You're just there to provide assistance. So this patient is a left-sided weakness patient because he's status post-stroke. So the first step in this transfer is we want to get him closer to the edge of the bed so we can assume that sitting position. So I want you to bring your knees up. Good. And you can help out with the weak leg. Bring that one up there. Bring both arms onto the patient's chest. All right. So now, stabilizing the weak-sided leg, I want you to push your hips up, bring them towards the edge of the table. Go ahead. Good. Bring your legs over. Help out with the weak leg. All right, one more time. Good. The legs over. Good. So now we're in a good position to roll. All right. So taking the strong arm, bringing it outside, leaving the impaired arm on the chest. We're going to facilitate by placing one hand on the impaired leg, one hand on the rib cage, and on the count of 3, we're going to roll towards the edge of the bed, all right? So ready? 1, 2, 3. Good. So now the patient's in good position to get into that sitting position, all right? So the first step in getting into the sitting position is we want to kick the legs off of the table, and then I'm going to have you prop up on your elbow, and then the therapist facilitates with one hand on the hip, one hand on the axilla, and we bring it into that sitting position, all right? So using your good leg, I want you to bring both of your legs off the table. Good, that nice hooked position. All right, so on the count of 3, we're gonna go up, all right? 1, 2, 3. And then always stabilize your patient, never leave them unguarded. And now he's in that nice sitting position.
The next transfer is a sit to supine transfer for a patient with right-sided weakness. So the patient's going to use their strong side, in this case the left arm. They're going to put that on the table. That's going to help them control their descent. So they're going to go down onto their elbow on the strong side, and then they're going to use their strong left leg to lift their weak leg up onto the table. And once the patient is in a sideline position, you're going to have them slowly roll onto their back. And then you can adjust the patient's feet and hips as necessary.
So the next transfer we're going to work on today is the sit to stand transfer. There's a couple different variations of this transfer depending on the ability level of your patient. This patient here is a maximum assist patient, meaning that he needs maximum assistance from a therapist to achieve the standing position. So he's right-sided weakness, but the first step is to scoot the patient towards the edge of the bed more. You do that by moving one hip at a time. So move the right hip. Good. Reposition the lower extremities. Good. All right. So then he has right-sided weakness again, so we want to guard that right knee very closely to make sure it does not give out when we go into the standing position. So we do that by placing our knees on that knee. Grab down by the patient's hips. Have your patient lean forward so their head is on your shoulder. We're going to rock back and forth 3 times. 1, 2, 3, and achieve the standing position while maintaining the guarding of that right leg.
The next transfer is a sit to stand transfer when the patient needs minimal assistance to perform the transfer. So one hand is going to be on the patient's weak side shoulder to provide guidance. The other hand is going to be on the patient's weak side knee. And this hand is going to push through the tibia towards the floor. So when the patient's ready, you're going to count to 3, and on 3, the therapist will push through the floor and provide guidance through the shoulder, and the patient's going to stand up on their own. You ready? So on 3. 1, 2, 3.
The next transfer we're going to be performing is the stand to sit transfer. So from the standing position, the patient will back up until the backs of their legs are touching against the surface that they will be sitting on. As they slowly lower themselves down, they will reach out behind them and use their arms to lower themselves into the seated position.
The next transfer is a stand pivot transfer into a wheelchair. So you're going to transfer towards the strong side. So in this scenario, the patient is strong on his left side. You're going to have the patient in a good sitting posture with his feet flat under him with a wide base of support. You're going to grab the patient at the hips, and then you're going to rock back and forth. And on the third rock, the patient is going to stand up and pivot towards the chair. So on 3. 1, 2, 3, and up. The patient pivots towards the chair, reaches back for the chair with his hands, and slowly descends into a sitting position.
When ambulating up the stairs with an assistive device, such as crutches or a cane, you will have the patient lead with their good leg, followed by the impaired leg and the crutches or the other assistive device at the same time. So in this case, his left leg is a strong leg, so he will lead up the step with that, followed by the crutch and the impaired leg. However your patient is appropriate.
Ambulating downstairs with an assistive device, you're going to use the impaired leg with the crutches first to go down, followed by the strong leg. So in this case, the patient's right side is impaired. So he's going to take a step down with the crutches and the right side at the same time, and then followed by the strong leg. Weak side and the crutches, followed by the strong leg. And make sure you guard your patient appropriately.